Hi, my name is Maria, and I'm going to go over two of the prevalent cancers in the United States today, one of them being breast cancer. Breast cancer is one of the leading cancer killers amongst women. Some of the risk factors include inheritance of the cancer gene BRCA1 and BRCA2, also a family history amongst one of your first-degree relatives, such as your sister or your mother. Women who are between the ages of 30 and 70 are at higher risk. Although women are at higher risk for developing breast cancer, it does not mean that men cannot develop it, because they can. Increased estrogen exposure. This includes women who do not have children because there is no disruption in their menstrual cycle. Also, women who have a high number of menstrual cycles. Also, the use of oral contraceptives. Women who are undergoing hormone replacement therapy as well are at higher risk. Also, obesity is a risk factor because fat does produce estrogen, and high consumption of alcohol can put you at risk for this cancer. Ways for early detection. There are 3 ways we would do this. We have the breast self-exam, we have the breast clinical exam, as well as the mammogram. It is really important to stay on top of this so that we can detect this early to prevent the prolonging of the treatment and also increase your chances of remission. I have this poster here. It goes over 3 steps to conduct a breast self-exam. While lying down, use the 3 middle fingers and apply 3 levels of pressure in a circular motion. Follow an up and down pattern. Check for changes with hands on hips and chest muscles flexed. Examine underarm while upright with arms slightly raised. These are posted in the doctor's office. You can also consult with one of the medical professionals if you feel that you're not quite sure if you're doing it right, or if you don't know exactly what you're looking for. This is recommended that we conduct this on a monthly basis. It's simple that you can do while you're changing, or something you can do when you're in the shower. The breast clinical exam is very similar, but it is done by a medical professional who does know exactly what abnormalities that we're looking for. This is done on women between the ages of 20 to 39 every 3 years, and after 39 it is recommended that it's done yearly. Mammograms are done yearly for women over the age of 40. If there is a suspicious mass that they find in this mammogram, a biopsy will be done to further explore what's going on. Treatment of breast cancer, stages 0, 1, and 2 would require a lumpectomy and breast irradiation. As for later stages of the cancer, you would require total mastectomy, or a radical mastectomy, or a modified radical. In a total mastectomy, you would remove the entire breast, remove the breast and the infected lymph nodes. With the radical mastectomy, you would be getting rid of the breast, lymph nodes under the arms, the fat, and the muscle. With a modified radical, it would be the same, except you would not remove the muscle. Also, in later stages, you could undergo immunotherapy, which shrinks the tumor cells as well as stops the multiplication of these cells. Hormonal therapy, which stops the estrogen action, as well as chemotherapy, which blocks the tumor activity. The second cancer that I'm going to discuss today is skin cancer. Some of the risk factors include fair skin, those who are lighter in complexion; heredity, if you have a history of a first-degree family member who has skin cancer or has a history of skin cancer. This includes mom, dad, brother, sister, or having 2 or more relatives who have a history of skin cancer will put you at risk. Prolonged exposure to UV light. Anyone who spends a lot of time outdoors, sunbathers, construction workers, any part of your body that's exposed to the light is prone to getting skin cancer. History of excessive sunburns when you were younger, spending a lot of time outside or in the summer times and you got a lot of sunburns, this puts you at risk. Having several moles, varying sizes, or having family history of unusual moles will put you at risk as well. There are 3 different main types of skin cancer. We will refer to this to kind of give you a look. We have basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Basal cell carcinoma, it is rare for this to metastasize. For basal cell carcinoma, you are at risk for this if you are over the age of 40. For squamous cell carcinoma, having a high amount of x-rays or trauma to an area such as burns or ulcers. Also having a weakened immune system or changes in genes related to melanoma. For malignant melanoma, this is one of the most common cancers amongst women 25 to 29 years old. This is second to breast cancer in women 30 to 34 years old. You are at risk for skin cancer if you are younger than 40 years old. 50 years old, that is, sorry. If you reside closer to the equator because of the increased intensity of the UV light in that area, you are at risk. Also having light blue eyes, light hair, or skin that burns easily. This could mean freckling. Early detection, it's a good idea to always monitor your skin and keep a lookout for any new moles or areas that are pigmented. Any changes to your skin really isn't good, and you might want to follow up with the doctor, especially if you see a change in the size of a mole or a pigmented area, the color, or even the shape. It's a good idea to follow up so that they can do a biopsy and rule out cancer and get further evaluated. Kind of to give you an idea of what you should be looking for. For basal cell carcinoma, these look like moles, pimples with pearl-like borders. They could be scaly, crusty, and may bleed. Squamous cell carcinoma can be flat, red, scaly, or slightly elevated. For malignant melanoma, we would look for key signs of A, B, C, D. Asymmetrical, borders that are uneven, colors, they're usually more than one color, and the diameter. Their diameter are usually bigger than a pencil eraser. Treatment includes surgery, cryotherapy, and freezing with liquid nitrogen, but for later stages of skin cancer would include chemotherapy, radiation, biological therapy, which helps fight the cancer, as well as target therapy, which actually targets the cancer cells itself.